Hello, this is Dr. Kim Jong-il. Today, I will lecture about the horizontal analysis and the anteroposterior analysis in the orthodontic diagnosis. Anteroposterior analysis was already mentioned in the basic diagnostic course. If you are new to APDI, please refer to the basic diagnostic course. Dentally, this patient appears to be a class 2 malocclusion. Is it really class 2 malocclusion, or does it have a tendency to class 2 malocclusion? Or is it skeletally class 1 malocclusion? We will have to discriminate first. In other words, is it skeletally class 2 malocclusion, skeletal class 1 but dental class 2? Or skeletal class 3 malocclusion, or skeletal class 1 but dental class 3? Patients A and B have a skeletal class 1 with a 2-degree A and B. However, patient D shows a skeletal class 2 when looking at APDI measurements. Patient A shows a rather class 1 skeletal pattern. If we do extraction treatment, we consider the extraction of the maxillary and mandibular first premolar, or the maxillary and mandibular second premolar in skeletal class 1. If it is a skeletal class 2, what extraction options would you consider? Because of the large overjet, it is possible to extract the premolar only for the maxilla, or consider to extract the first premolar for the maxilla and the second premolar for the mandible. In other words, not only looking at the model, but also depending on the skeletal pattern, the options for extraction may vary. This means that while we level the teeth or close the extraction space, the skeletal class 2 will try to go to the class 2 and the skeletal class 1 will go to the class 1. We have used various measurements such as A and B, widths, APDI, AB, plane angle, facial convexity, SNPOG, and facial angle for anteroposterior analysis. When trying to classify these measured values as a graph and classified into class 1, 2, 3, some items are redundant as in the graph above, making it difficult to classify, while some items were easily classified as in the graph below. First of all, A and B is the most used item when evaluating anteroposterior analysis. However, A and B sometimes has the following problems. In Figure 1, the skeletal anteroposterior state has the same, but the measured values may be different when the nasion is located in the anterior or posterior. In other words, if the nasion is in the front, A and B will be 0 degrees and showing a class 3 pattern. On the other hand, if the nasion is in the rear, the A and B is larger and showing a classified as class 2. In Figure B, the value may vary depending on the vertical position of the nasion. Figure 2 shows that if the B point is different in the vertical position, even if the B point has the same A and B value, it may show a state of class 2 with a more severe anteroposterior relationship like the red line. Hand-conducted ROC analysis when discriminating between class 2 and class 3 in the thesis. ROC analysis has already been mentioned in the basic diagnostic course, so please refer to it. This paper evaluated 976 malocclusion patients, and the conclusions are as follows. When evaluating the skeletal class 2 and class 3, it was concluded that the best analysis method was APDI. APDI is organized in a thesis published by Professor Kim in 1978. 102 normal occlusion patients and 874 malocclusion patients were evaluated, and the patients were classified into class 1, 2 and 3. At this time, when measuring the correlation coefficient between each other, APDI was the measure with the highest significance. So what is APDI? APDI is the sum of three measurements. The first measurement is the facial angle. Facial angle is the angle between the FH line and the nasion-Pagonian line. Patient A is 80 degrees and patient B is 90 degrees. In patient B, the mandible is more anteriorly. The second measurement is the AB plane angle. AB plane angle is the angle between the facial plane and the AB plane. This angle has positive and negative values. If point A is located in front of point B, it is negative value. If point A is located behind point B, it is positive value. This must be remembered. The third measurement is the palatal plane angle. The palatal plane angle has already been measured when calculating the ODI. This is the angle between the FH and the palatal plane. APDI is thus the sum of the facial angle, AB plane angle, and palatal plane angle. Again, the Downs AB plane angle is a value if point A is located in front of point B. Looking at the APDI average, it was around 81 for both Westerners and Asians. So please remember the number 81. In order to evaluate the skeleton on the graph, the axis is shown as an anteroposterior relationship. It can be seen that the smaller the APDI, the class 2 malocclusion, and the larger the APDI, the class 3 malocclusion. According to the APDI paper, the average of 81 for normal occlusion, 80 for class 1 malocclusion, 75 for class 2 malocclusion, and 88 for class 3 malocclusion. Therefore, when classifying the patient's skeleton, it can be judged that an APDI of 81 tends to be class 1. If it is less than 77, there is a tendency for class 2 malocclusion. And if it is greater than 85, it is a tendency to be class 3 malocclusion. Also, if it is less than 75, it is considered as class 2 malocclusion. And if it is greater than 89, it can be considered as class 3 malocclusion. This is a summary of the items that can be evaluated through APDI. First, you can classify different skeletons relatively easily. That is, whether there is a skeletal class 2 or skeletal class 2 possibility. A skeletal class 1, a possibility of a class 3, or a skeletal class 3. Next, if APDI is greater than 85, the possibility of skeletal class 3 is high. And if APDI is less than 78, the possibility of skeletal class 2 is high. Next, APDI levels affect stability after treatment. In other words, if the treatment is completed with an APDI close to 80 after treatment, the anteroposterior relationship of this patient can be relatively stable as a class 1 state. However, in patients with skeletal class 2, if APDI is still less than 80 after treatment or less than 77, it can be said that there is a high possibility of recurrence of class 2 malocclusion in the future. In fact, in the case of adult patients, there is a limit to changing APDI in the anteroposterior relationship. If possible, the APDI value after treatment is 80 and will be treated to create a class 1 relationship. There is also a limit to matching the ODI to the average of 74. APDI is the sum of three measurements: facial angle plus AB plane angle plus palatal plane. When we calculated this geometrically, We simply found that the angle formed by the palatal plane and the APDI plane was approximately equal to the sum of the three angles. So now APDI simply measures the angle between the palatal plane and the APDI plane. From Ceph, if this angle is 80, it is a skeletal class 1. If it is 75, it is a skeletal class 2. And if it is 90, it is a skeletal class 3. In this way, we have learned about APDI, which can easily classify the anteroposterior relationship of the skeleton. If the APDI value is 86 and 75, it can be easily classified into skeletal class 3 and skeletal class 2. Thank you for watching.